The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Ageless Health Livestream. Dr. Tom Roselle here, and got another great program for you today. Try to make your life a whole lot better than it's been up until now, and maybe a little tweak and push and turn, and you can make it a whole lot more, I want to do this and go out and get it done. That's why we do the program. That's why we make it happen. Listen, I want to remind you that if you're in the Washington metropolitan area, coming up on the 10th of August, and that's not too far away. This month is passing by very, very rapidly, very quickly. We're going to be doing an in-house continuing education program. I think that you're going to enjoy it. It's all about your low back. And if you'd like to attend, and we're going to teach you how to help yourself, not just get treated, but help yourself. There's things that you can do. And we're going to try to unveil some of the underlying triggering causes and how to determine whether or not, is it your low back or is it something else that's going on inside of you? And we're going to touch on that today. And I want you to really sit there, take notes. And by the way, make sure you're following me on all your social media sites. Go on and say, follow, right? So we can let you know what's coming up. We can send you pieces of information, and that we hope that you'll share. It's important. My job is to provide you with the data, the information. Your job is to discern it and to make sure that you have all the information, all the tools, and so forth. Okay, let's get moving on this thing, and let's talk about some of the pieces of the puzzle that you need to know about. So your back hurts, right? And you have buttocks pain, and you have hip pain, and you have, it hurts. You can't move. It's going, in 1,000 different directions. And you take your NSAIDs, your non-steroidal anti-inflammatories, your aspirin, your Advil, your Motrin, and maybe things that are stronger than that. You've been on it for a long time, and you're getting hooked. You're getting addicted to this stuff. You can't function. And it hasn't really done that much. Now, you go to the doc. They're well-meaning people. And you go to see guys like me, and maybe they're just structural guys. And, they do a great job. You feel good for a short period of time, but all of a sudden it comes back. The question is, what's going on? What's underneath all of that craziness that keeps this thing in position? You're not supposed to live with pain. It's not supposed to be there. So why is it persistent? Why is it something that nobody seems to have an answer for? Well, we're going to show you how to do that today and kind of diagnose things, because you got to diagnose it properly. But I want you to consider this. You go to your doc, and he or she decides that it's a muscle strain. And they're going to tell you to take this for that and go home, rest it, don't do anything out of the ordinary. They may give you a little bit of light stretching and motion and torsion and torquing, but it still doesn't do anything. You stop the drugs, you stop the medication, and guess what? It's still there. Now, we've talked about, some of us have a little bit of extra equipment on the waistline, if you will, right? Not supposed to be there, as we've said before. You go back a couple dozen years, and you find that people didn't look like we look. They were thin, they were athletic, they were moving, they were doing, and generally they didn't have the problems that we have today. But when you're talking about low back pain, you're talking about that at some point that you have in the neighborhood of about 40 to 45% of the population that's in pain right now. That's a lot of people. And most of you, 70%, will have back pain at some point of their life. Persistent, doesn't like to go away, but you got to find out what it is, right? So let's put that together a little bit. Let's figure out what this monkey on the back is all about. If you walk on your toes, you should be able to spring lightly. I'm not talking about being a ballerina where you can need toe shoes and things like that. But if you walk on your toes, it shouldn't be a problem. You should be able to at least get up on your toes and an inch or two and then drop down. You should be able to get up on your heels and walk for a little bit and then get back down. What happens if you can't do that? What happens if you try to get up on but there's no power? What happens if you try to get up on your heels and you can't bring your toes up? Why is that a problem? So that in of itself is diagnostic of something that may be going on. You could have some leg pain with it and so forth, but that low back hurts, but you can't do that. If you can't get up your toes, it's the last disc space in your low back. It's between the lumbar 5 vertebrae and the sacral base. That nerve area in through there is being compromised. That's what allows you to get up on your toes. If you can't get up on your heels, it's the one above that. That's lumbar 4. How many of your docs do that simple diagnosis? Mrs. Jones, get up on your toes and walk for me. Walk on your heels for me. Do they ever do that? Rarely, if ever, unless you get some maniac like me that says, I got to find out where it's coming from. Here's another piece of the puzzle. If you bend forward and you get stuck at about 10, 15 degrees, and you can't go any further than that, what does that mean? Well, it just means that your back's not working the way it's supposed to, but do you know where it's coming from? Do we know it's the low back, the lumbar spine, or is it in the pelvis? How do we diagnose that? Something simple. You're in the doc's office. How can they tell you which one is which? They're going to what do? Send you out for an MRI or an X-ray, and let's go do this EMG or whatever it is. No, there's simpler ways of at least getting an idea. So if you're in my office and you tell me you have back pain, one of the things I'm going to have you do is I'm going to have you bend forward, and then I'm going to put my arms, I'm going to get behind you, and I'm going to put my arms around your hips, and I'm going to brace them, and then I'm going to have you bend again. And this time, if you get further down, you know what it tells me? It tells me it's coming from your pelvis. Your sacroiliac joints are not working the way they're supposed to. But if I brace your back and I have you bend and you can't go as far as you did before, or it creates more pain, that tells me that it's coming from your low back. Why? Because I took all the motion out of your pelvis and put it all into your lumbar spine. So it's irritating what's already there. So now we know. We know where it's coming from. Those little simple tests that if we did them properly, it would give us a better diagnostic of where it's coming from. I may have you sit in a chair and I'll bring your knee up and I'll push down on your knee, stabilizing your shoulder. If you can't hold that support in your leg, in your knee, your hip, that tells me that somewhere in your low back is misfiring. Generally, it'll be lumbar 1, 2, 3, maybe 4. And there's muscles that are associated with that. It could be the proximal portion, the upper portion of your thigh, your gastrocnemius muscle, or it could be the iliopsoas muscle that comes down from the lower part of your spine and attaches into your leg. So you have to be definitive. You have to find out what it is. Sometimes we go to the other end. But for today, I want you to remember those things. You can easily diagnose where, if it is structural, by doing a couple simple tests. Does it give you all the answers? No, you still have to do a little bit more to find out how to approach it, how to get things working the way they're supposed to. But let's talk about things that maybe don't show up the way they're supposed to, okay? Let's talk about the endocrine relationship to low back pain. And what does that mean? That means that you have organ systems that can reflex pain to the spinal system and other muscular areas, but we're talking about the back, right? So yes, in fact, your endocrine area, your organs, your intestinal tract, your ovaries, your uterus, ladies, guys, gonadal areas, and so forth. If there's something that's not working properly, it can move back to that area. Now, in addition to that, there are other things, other signaling patterns that may be a problem. So when we're talking about low back pain, there are things that can make things much worse from the structural pattern that we've been talking about. So would you believe that the hormones in your head that's produced in the pituitary called growth hormone, it can be an overproduction in a subtle portion that can cause these problems within the joint spaces, because they can cause hypermobility, they can cause instability, they can cause things to increase in size, hypertrophy, that they can result in that neuropathy pain. So somebody comes in with low back pain, one of the things I'm going to check is the skull. Why? Well, these cheekbones are called sphenoids, right? And they come together like this and make a hard palate. If you took your thumb and you push up the top of your mouth, that's our hard portion. You got the soft one behind that. But in the center of that, there's a little saddle. And that little saddle houses something called your pituitary. And if it's being irritated, the production a thyroid problem, because of overstimulation from this pituitary, also can affect the skeletal system, the musculoskeletal system. And so we don't think about that. How many of your docs take the time when you come in with low back pain to really assess that, to see if it's intertwined? Then you have your fight flight. You get out and fight the tiger, right? That's your adrenal system. And we can have something, if in my world, we call it a hypoadrenal function or a hyperadrenal function. And you look in the medical textbooks and they call it hyperaldosteronism, or they call it Addison's disease. And that's adrenal insufficiency. But it can be a subtle, low-lying problem. So when there's an upregulation or a hyperaldosteronism, then you're producing way too many of something called mineralocorticoids in your body, and it can cause weakness and neuropathic pain, and due to dropping down potassium. So your potassium level is being eaten up by your adrenal system because it needs that. It needs it badly. But all of a sudden, you're starting to see these other things show up, and it's because you're always in that fight flight. You're chasing the tiger. But see, what happens if you stay there too long, you go into the counter portion of that, and that's called adrenal insufficiency or hypoadrenalism or Addison's disease. If it's, and a lot of your textbooks are going to say it's an autoimmune problem, but I have to differ with them. It can be just hyperfunction over an extended period of time, just like you're lifting weights, and pretty soon you can't do it anymore. Even that 5-pound weight, that 10-pound weight, you get to the point of, exhaustion. Your organ systems can do the same thing. And so you have to make sure that you understand the mechanism behind it. And if that's not doing what it's supposed to be doing, it's a horse of a different subject. Look, we have to balance the body's endocrine system out, because if it's not working the way it's supposed to, we got a problem. Ladies, as you get older, and you stop producing the levels of estrogens that you normally should produce, you can have some pelvic problems. You can have some pelvic floor problems. You can have low back problems simply because your estrogen levels are no longer normal. Now, your estrogen levels are produced in two places primarily. One is your ovaries, but when you're done producing ovum, eggs to produce children, the amount of estrogen from those areas drops. That's where you go in through your perimenopause and menopause, and that's where you're at. What's supposed to take over is the outer shell on the adrenal glands. That outer shell expands just a little bit, and it produces your estrogens, your progesterones, your testosterone. Yes, we need testosterone, ladies. You got to have it. But if they're not being produced at the levels that they should, then it's going to contribute to ligament weakness. It's going to contribute to joint spaces that don't have tensile strength, if you will. And that low back can be made much worse simply because of that. So, the body's meant to be in balance no matter what age we're at. But you've got to figure out where that is, and you have to support it accordingly. And you have to make sure that it's operationally working the way it's supposed to. Now, we talked about estrogen. Now, there's another piece. And by the way, guys, you're not excluded from this. That conversation with estrogens and progesterones, That's about you too, because you have to have them. And if your adrenal system's not working, you got a problem. Now, we could really extend this and talk about the environmental estrogens, and they're called phytoestrogens. They don't affect the body in a good way. There's other reasons, and we'll talk about that in different subjects. But stress then is another consideration. So what are we looking at? We're looking at stress and the production of cortisol. Now, cortisol stress, if you will, can lead to increased inflammation. So you get a joint that's a little bit hurt and you're under a lot of stress, guess what happens? That inflammation goes through the ceiling. Now, here's the thing with cortisol. Cortisol, too much, eats you up. Too little, you can't fix anything. So here's another one of those sweet spots. You got to figure out which is which. So if you know that you're in fight, flight, stress pattern constantly, you're not going to repair anything, my friends. It's just not going to happen. So we take those things into consideration. So the physiological effects, if you will, of pain in the low back is significant, and it's finger pointing, but you got to figure out where it's coming from. So when you have, let's get back to that problem with estrogenics just a little bit. So when you have estrogens that drop, okay, so guys, we're talking about your testosterone and your estrogen. You can't get away from it. Sorry, but that's just the way it is. So when the estrogen levels drop, you increase your risk of degenerative disease within the spine, leading to things like stenosis and things of that nature. Also, you have to look at levels of different vitamins and nutrients and chemistries. It's almost considered absolute that if you have low back pain that's related to degenerative disease of any kind, your vitamin D level is probably very, very low because it affects the disc spaces of the body. So here's our friend vitamin D again, right? Not only disc problems, immune problems, calcium metabolism, neurological transmission. It's one of the most important things, and most of us suck when it comes to getting enough of it. You say, well, I get out in the sun, well, what, for 5 minutes? You know, and today's kids, most kids are vitamin D deficient. They're breaking things, they're breaking limbs, they fall and they bust things up because they don't go outside and nobody gives them the nutrition that they should have. How many kids take a natural, good, solid vitamin? You know, when I grew up, my mother used to give me cod liver oil, and I used to get some vitamin C, and she gave me a multivitamin, and I got the things that I needed to have. Plus, I was outside. I was outside all the time. She said, you know, what do you mean good? Go outside. It's raining. I don't care. Go outside. We don't do that with our kids today. So their muscle mass, their bone tensile strength, and so forth. But let's relate that to us as adults. Do we get outside? Do we take the nutrients we should? Or are we grabbing a candy bar and, you know, a soda, which is going to further deplete things? And by the way, so if your diet has a lot to do with drinking sodas on a regular basis, if your diet has a lot to do with, you know, eating tons of sugars, guess what it's going to affect? What we were just talking about. It's going to affect that fight-flight system because it puts you in hyperdrive, and then it crashes you. But more importantly, if you're drinking sodas, you're depleting calcium from the body. And if you're depleting calcium from the body, you don't have any tensile strength in your bones or in the ligament structure or in the disc spaces that protect it. So we have to make sure that we understand that there's a linkage other than just, oh, I'm not in shape. Sometimes we're too fat. Sometimes we don't have any tone in our bodies. But are we supporting it otherwise? I'll give you the other piece of the puzzle here that everybody wants to avoid. How much protein is normal? Because if you don't have enough protein, you can't heal anything. Protein produces amino acids, produces peptides, and peptides are what allows tissue, particularly collagen and muscle tissue and ligaments and so forth, to heal. So you got to get enough of it. So somebody says, you know, I got that, but I'm vegetarian or I'm vegan. Well, it just means you got to eat a whole lot more. and you got to take the time to make sure that you pick wisely and that's your digestion. So if you're vegetarian, that doesn't mean you should be eating sugars and carbohydrates, fast acting foods of any kind. That means you pick your foods properly. The nutrition department at the Roselle Center for Healing could help you with that, by the way. If you want, all you got to do is give them a call. They'll do what they need to do, and we'll get it done for you. But here's the deal. That's on you. That's a do-it-yourself program. Now, how much protein should you get? And we're talking about all sources. The only one that I won't tell you ever touch is pork. I just ruined 10,000 diets out there right away, right? Well, pork is a problem. Pork is, we'll get into a different program. Just, you don't want to light my fire up on that right now today, but stay away from pork. But grass-fed, free-range meats. It can be beef, it can be bison, it can be venison, it can be fish, it can be chicken, it can be, and we're not talking about, by the way, we're not talking about shellfish. You can have that on a rare occasion once in a while as a treat for you. But we're talking about the things that we can eat. Man ate those things and had better bones. You find remnants of 15,000 years ago, and these people still had their teeth in their head. Their bones were still strong. How did that happen? Well, they were eating natural diets. They died from other things, not those things, but they're eating solid diets. You need to get that protein level up. A minimum, if you're a 150-pound person, you need to be getting at least 75 to 80 grams of protein a day to repair. You say, oh my God, I can't eat that much food. Well, consider that 4 ounces of meat, fish, chicken, something in that neighborhood is about 27, 28 grams. It's not that hard. You get an egg, 7 grams of protein. So you start out the morning, 2-3 eggs, on every other day or something of that nature. I eat about a dozen eggs a week. And so now you got maybe 14 to 21 grams. You get a piece of fish or a piece of meat. And most of us are going to eat a little bit more than 4 ounces. Now, all of a sudden, you're up over 50 grams of protein that quickly, that fast. Now you got to just get another meal in there during the day and eat well, combine it with your vegetables. And now you've got the mineralization to process it and stay away from the junk. What's the junk? Sugars and sodas and coffee and black teas and fast foods and fried foods and alcohol and gluten and additives and GMO products. Make sure that you become your own vigilance, if you will, in turning things around. Now, listen, on an ongoing basis, my job is to show you what needs to be done. Check out the website. Go to drtomroselle.com and check out the things that we have available for you. I can promise you, you go there, you go to rosellecare.com and go to Ageless Health Store there. And there's a bunch of really good things that we have on the marketplace for you. Check it out. I think you're going to find that they're supportive. And always remember, if I can be of help to you, all you got to do is send me a note. Go to drtomroselle.com. drtomroselle.com and send me a note. I'll answer you. I promise. I'll get to it. We'll get it done. I'll point you in the right direction. If you need a referral outside the Washington metropolitan area, let me know. I'm all over the place teaching. I only would send to you those people that I would send my own family to. There's some great people out there that know their stuff. So life is about your health, your viability, your energetics, and you're the one that has control. So don't forget, coming up the 10th of August at the Roselle Center for Healing in Fairfax, Virginia. And I think that I made the mistake, and it's not the 10th, is it? I'm going to have to double check. It's the 14th. I keep saying this 10th. I don't know why I do that, but it's, I talk too fast and my brain goes, it's the 14th of August at the Roselle Center for Healing in Fairfax. Join me then. And we're going to be talking about your low back and the things that we can do. But Dr. Harlan Browning, we call him lovingly the professor. This guy is amazing. He's got more information in, left side of his brain than most people have in their entire brain. And if you've heard him speak before, he just keeps on giving and giving and giving. So join us on the 14th, 6 p.m. at the Roselle Center for Healing. And all you got to do to reserve is go to drtomroselle.com. That's drtomroselle.com. Or call the office to do it the old-fashioned way, 703-698-7117, 703-698-7117. On your screen right now, I think you can see the how to make that happen. And I'd really like to meet you. So if you haven't been over, and we're going to spend the time, we'll answer your questions. And again, it's important that you take control. Health is a do-it-yourself program. And by the way, which is the name of the book that I wrote, a few years back. And I think there's some still available. You can get them off the Dr. Tom Roselle website. But more importantly, let me know how I can help you. Let me know what I can do to make your life more viable, better, more energetic. And remember something, I do this ongoingly, and I'm never going to stop for one reason only. You deserve it, but more importantly, I love you all. Have a great Sunday. Bye.